Dr. Chaves, I want to talk to you about sedation dentistry. Not all dentists in the country are yet doing it. Relatively few, in fact. Number one, why is that? Is there some special training needed? And tell us the advantages of it, and if there are any disadvantages and side effects, tell us them too, please.
Yes. Well, sedation is a very useful tool for the dentist to help his extremely phobic patients to get through their dental needs. Sedation in the state of California, as it's defined here, is basically a relaxation technique where the patient becomes very relaxed, remains awake, but becomes very relaxed. Sometimes they may actually fall asleep, but we try to wake you up and stay in continuous communication with you. Okay? It's not designed for you to pass out and just zonk out. We want you to be awake, but we want you to be relaxed. It's really more about dealing with extreme phobias. It's got nothing to do with whether or not you experience discomfort. That is managed with topicals and with anesthetic. So the topicals and anesthetic are going to control your discomfort. The sedation really is designed to just relax you and get you through all the anxiety that some patients have.
So are you telling me that a person who gets sedation dentistry, who gets sedated,
yes,
still needs to get the Novocaine and
absolutely,
whatever that is these days?
Absolutely.
Ah, so the sedation doesn't numb the pain the way, whatever else you do.
No. Sedation really, it's more about numbing the brain. It's more about relieving anxiety.
It's a better substitute to laughing gas. Is that what it is?
Yes, it's
I'm probably crude here in the analysis.
Yes. So we use laughing gas as a technique to handle stress, to relax the patient, to get them to not be so fearful about what they're imagining is going to happen to them, because it's really what they imagine. Because really, at dentistry today, we can, by and large, get you through almost any dental procedure, no matter how long it is, no matter what it is, without any pain. We just have the techniques nowadays.
So the pain actually wouldn't be there anyway, so it's really our state of mind which says, I don't want to be there, I cannot be there, this is whatever, and now the sedation dentistry comes in very, very, very handy for those people.
Yes, for your extreme phobics. So when I have my basketball players who are 7 feet tall, but they're extreme phobics of dentistry, and they'll pull up in their Bentleys in my parking lot and they'll call me on the phone, Johnny, I'm not coming in, I'll come tomorrow, man, it's not a good day. And they're crying, and I haven't even seen them yet.
I hope little Johnny doesn't hear this, because he looks at those basketball players as the heroes of all heroes with no fear period.
No.
Do you know what I mean?
It's the big boys that are the most scared.
It's the doctors who pass out when they have to go in the dental chair, right?
Yeah. It's the little old ladies that have no problem. It's the big guys that fall over and pass out on you, etc. So, but really, what I try to do is actually empower my patients. I try to have, if for instance a patient has not been to the dentist in many years because of fear, primarily because of fear, I pick the simplest part of their treatment and invite them in just to address that. And we make sure that we control every aspect of their visit and make sure that it's positive and that they experience zero discomfort. Now, if they go through that once, a little light bulb goes on up there and they get a sense of empowerment. They realize, hey, I can actually do this. Now, they're not excited about coming back, but I just gave them a little bit of strength, a little bit of psychological strength. And sometimes I have them come back for the next most important thing. And step by step, they start to realize they can handle this.
So what you really try to do is try to talk them out of it. You try not to do that. You try not to literally make an extra buck here, because I'm sure this stuff costs money.
Yeah, no, it's expensive.
Right. So, so you try it, because it has no, for you in terms of working with the guy, has no advantages.
Well, listen, I have a philosophy. I'm a minimally invasive dentist. So,
Mhm.
so I come
I'm sure
from
people like that.
I come from a point of view where I want to touch you as little as possible. I want to get you to be where you want to be, aesthetically or functionally, etc. But figure out how can I do this with you keeping as much of your body parts and invading you chemically as little as possible. So if I don't have to numb your brain or give you medications to dope you up so you can emotionally get through this, and I can empower you and let you get through it and be totally fine and have no pain and be and realize that you own this. You own this experience.
Yeah.
You're not an emotional cripple.
Yeah.
You're on the I can only go to the dentist when I'm knocked out. I have to be out.
Yeah.
You know,
Yeah.
and that's the kind of person I am. If we can take away that label from you, and
make
you
the
can
person stronger in probably many other aspects of life as well, not only in dentistry.
Oh, absolutely. We've empowered hundreds and hundreds of people that were emotional cripples. I mean, they came in, and I have patients who literally will stand outside the parking lot just sobbing, you know, and they're coming here for the first time, and they're just crying in the parking lot. And we come out there, and is everything okay? Does something just happen? Says, oh, I'm just really scared. And they'll come and they'll sit here and they'll start sobbing out of the blue, which we don't really like. We don't like patients crying in the waiting room. It's never
It's not good for the other guy. I mean, it might be infectious, right?
Yes. Maybe they think I'm having a bad day. You know?
Yeah, there's another guy who isn't quite as bad off, but is not exactly, you know, so he may go. Yeah.
That happens all the time. But the concept is, if you absolutely need it, it's here for you.
Good.
But I actually try to help you, empower you, not to do this.
Let me ask you, what about the advantage of, for instance, I get bored and start counting sheep with just my cleaning. You understand? Or I remember a decade or a little more ago, I had a root canal and a couple little other things he did at the same time. The whole thing took an hour and a half, maybe, or whatever. And it was not painful, to my total surprise, kind of, you know, but it was boring. An hour and a half in a dental chair is very boring. So what about the people, these executives, not just executive, anybody, you know, because time, like it or not, we're all a little bit time concerned these days.
Right,
whether it's a home mom, probably more than an executive. Either way, we want to go home. We don't want to go 4 times to a dentist or 6 times. If possible, book me in, take me out 6-7 hours later. It's probably more effective.
Yes.
Now, what about those people? The time passes by. Would sedation dentistry be something for them, or is it again still an overkill, and they rather should count sheep because it's better for them?
Well, clearly you need to come visit me.
Have you looked in my mouth?
You may want to edit this.
You see that by just talking to me that I need to visit you? You're a dentist, I get it.
No. You know, for patients, we try to create an environment that is akin to a spa. You know, we'll have candles or aromatherapy. We have a TV going. The patient can engage the TV and change the channels. We have music for them to put over the ears if they just want to close their eyes. We have eye covers and they can listen to classical music or to spa music. We have many options to keep them entertained and keep their minds off. And plus we communicate with each other, myself and my assistant. We'll talk about all sorts of things and we engage the patient. So it's amazing how time actually goes by very quickly. Yes, if you have a lot of dentistry, what makes sense usually, it depends on case to case, is actually to take care of it all in one sitting. You know, just start once, be done once, and that's it. And we do try to do that. And sometimes when you're doing a full mouth reconstruction, you're rebuilding 28 teeth and doing 3 root canals all through a sitting. Sometimes that happens. You know, I have patients who fly in from New York, and they come in on a Monday, they want to leave on a Thursday, and they want to have everything done. Then they'll have to be in the chair for maybe 6-7 hours. Right. But of course we give you breaks, you go to the bathroom, you come back, and we take care of all your needs.
So even there, because since we're talking about sedation dentistry here, even there, you try to stay away. So you really, truly, in your heart and everything else, believe that as little invasive, as little medicine, as little knocking you out, as much as possible. Stay in your own control.
Yes, yes,
The
absolutely.
patient I'm talking about, not
You,
the doctor.
you got it. I want to deposit as few pills in your body, as few injections in your body, and invade you as little as possible. The only thing that's non-negotiable is throughout the entire procedure, you have to have no pain.
Mm.
That's the only part that's non-negotiable. So you'll get gallons, well, you'll never get gallons, but you'll get as much anesthetic as you need
in order to be
safely
pain-free.
to keep you pain-free.
Yeah.
And that'll be the limiting factor.
Right.
In fact, if I can't keep you pain-free, then that will terminate. If I get to a certain level of anesthetic and you're still feeling, which in fact has never happened in 20 years, but theoretically that would be the limiting factor as to how much we get done that day.
Right, I got it. Good. Wonderful. Wonderful news about, yes, sedation dentistry is here. It has a very valuable, it's very valuable for the people where the phobia cannot be overcome.
Exactly.
But perhaps, in your opinion, and I do happen to agree with you, more valuable is even coming to you or to a guy like you who doesn't just say, oh yeah, we have it all, which drug you want, and we knock you out.
Correct.
Is the fact that the guy comes to you and he afterwards goes, you know, my phobia was all in my head. It's not that bad. And he now can probably talk to his kids a lot better too and say, hey, this dentist business isn't all that bad. Where before he might have said it but lied through his teeth. And now he can truly say, you know, this isn't all that bad.
And I'll tell you something else. Of all the patients that I've done sedation, I've done hundreds of cases, of all the patients I've done sedation, I can't think of a single one today that still needs sedation. So we've been able, even the ones that we could not convince them.
Are you sure you're in the right business? You should be in the psychiatry business or in the counseling business. You are, right?
I mean,
that's it. It's just you're combining it, right?
I totally am. Half of what I do is manage people's emotions, and you really have to be empathetic. You really have to sense where the person is. Some patients will come in, they'll be very quiet. Those are the ones you know. You need to just slow down, just be in the moment with them. And you got to respect their fear. You got to respect their emotions, their fear, or whatever's going on. You got to respect them
because they have it. They're real to them.
Yeah, it's very real to them.
Absolutely.
You are a lion.
Mm-hmm.
They see the white coat and they're seeing a lion, you know. And you're thinking, no, I'm a putty cat. Trust me, you're going to be great. And they're like, no, that's not what I'm feeling. Don't talk to me that way because that's not what I'm feeling.
Right.
And you just have to step back, just be in the moment. And acknowledge that you know that they're feeling this, and not invalidate them, but just hold their hand and get them through the moment. And it's amazing. They'll just relax and they'll just open up. And when they're done, they'll like hug you and cry and thank you. You know, it's worth it.
Talking about added value, you know, I mean, you're value-added dentist. You just here's the dentistry, but hey, I have something else, and that's. I'm empowering you. The people might not bargain for that when they come. They might not know it happens still quite a time later, but I'm sure then they will kind of remember that turning point. Thank you very much.
Very welcome.